As the country continues to experience the fourth wave of COVID-19, the surgery list for children is getting longer. Shamela Pullen tells us more in the health report.
Prior to the pandemic, more than 1,000 scheduled surgical procedures were done on average yearly on children battling critical conditions. But since COVID-19, that number has trickled down to less than half. Consultant pediatric surgeon Dr. Noel McLennan says with each wave of COVID-19, the surgical list gets longer.
And so what happens is that the number of cases pretty much pile up because we cannot do the operations, the number of operations and the amount of time that we would normally spend to prepare the patient and get the patient ready and so on. All of that has been affected because staffing has been affected in every way, not only medical staff, but support staff. And all of that come together to push the waiting list even that much longer.
Dr. McLennan says these operations are usually time sensitive.
For example, there may be some children or babies who have been born with congenital problems, inability to pass urine or pass stool like normal. And so what we would do is to aim to correct this problem, say, before they reach the potty training age, so that by the time they get to that age, they would have already have the problem corrected and it's easier for them to transition like other normal children.
He offered this advice to parents and guardians.
As far as is possible, get vaccinated because, and as far as is possible, at least in this country, children 12 years old and above can be vaccinated. We have that available to us. So that, in my view, is the first thing. Get yourself protected because once you protect yourself, then you can, by extension, protect your children.
Teaching your children to observe the COVID-19 protocols is also important. With her health report, I'm Shamela Pullen wishing you good health.